Hi everyone, this is Dr. Chalam once again. I wanted to introduce to you today's podcast. This is actually a sample of our 5-day sugar drop challenge. I know when most patients reach out to a practice, they're looking for results. They're looking to get better. They're looking to resolve whatever medical issues they might have. But this cannot be done by just taking instructions. Sometimes you need education. And that's why we do these 5-day challenges, so we can actually open your mind to a different way of thinking. Number one. Number two, open your mind to the developments in a particular field. And as we all know, and I think intuitively you know that, when you have insulin resistance or diabetes, you know somehow you can get over it, you can resolve it, it can be gone. But how do you actually do it? That's what our 5-day sugar drop challenge is all about, is helping you understand the steps needed and taking a few on your own. There are places where you can do things on your own, all you need is some knowledge. But there are other places where you need help. And how do you differentiate between where you need help, where you need some guidance, and what is it that you can do on your own? That's what these 5-day challenges are for. And so today's podcast is a sample of what we do. Listen to it, enjoy, reach back with us, and of course don't forget to subscribe to our YouTube channel or download the podcast, share it with folks, and looking forward to connecting with you someday.
Hello everyone, can you guys hear me? Say yes, and can you see my little chart? And is it all clear for you guys? Hi Jan, I see you on Facebook. Tap in and let me know. Awesome. We get started. It's already 6. So welcome everyone. And today we're starting with a 5-day sugar drop challenge. And one of the reasons we wanted to do this is a very common question people ask, especially if they've been a pre-diabetic or diabetic, is how do I get off my medications? How do I reverse this? And what do I need to do? So this is what I'm going to go through. I'm going to try and give you practical, I have to simplify this, practical steps. So at the end of 5 days, at least you'll know 3 things that you can take away. So before we get started, a few things is, again, drop your Q&A into the Q&A box. Right at the bottom of your Zoom, you'll see Q&A. If you put it on the chat, it's very difficult for me to go back to it. I think Marina and Deb are going to be on this, but I don't want to rely on anyone just in case I miss the question. So go into the Q&A box and type in your questions. So at the end of the webinar, when I get to the question answers, I would be able to do it. And Dana, that particular curve is coming up tomorrow. Tomorrow I'm talking about all the hormones. Today we're going to talk about what puts you at risk for type 2 diabetes or metabolic syndrome. Is everybody got a pen, paper? Remember, I know you think you're going to remember these things, but whatever information I give you, there'll be something that will resonate, something that will stick. Make sure you write down that point. Okay, can we get started? Okay, let's get started. So welcome to the 5-day sugar drop challenge. So what I'm going to do in this 5 days, I'm going to run through the schedule a little, it'll be a little repetitive. Today, we're going to assess the risk. What puts you at a risk for metabolic syndrome? Many of us walk around saying it runs in my family. Does it truly run in your family? Some of you tell me it's because of your age, and that's what happens. That's what your doctor told you, that as you get older, you're going to be a pre-diabetic or have insulin resistance. Then others tell me because I was perfectly fine till I became menopausal. Is there any truth to that? So we're going to delve into all of those. And there's a few disclaimers that I have to start off with. Hi, Marina. So what I told them to do is to put all of their questions in the Q&A instead of the chat. So, we can actually delete the questions as we answer them. So
that sounds good.
That's where it makes sense. And then we have a few folks on the Facebook page. So somebody's monitoring the Facebook, and we can look at the Q&A here. Okay?
Right. Yep, sounds good.
All right. Before I start, the disclaimer is no physician-patient relationship is being formed. I am not advising you about your health. My job is to educate, give you information, help you ask the right questions when you go back to your primary care provider, or if you choose to work with us, then we pick it up from there. So either of those opportunities, that's what this does. So you have to be an established patient with me for me to order your blood test or give you advice. You have to sign all of those 1,000 papers so that we're all covered medical legally. I know I hate it. I wish I could just give you and tell you exactly what you have to do. Even on the third day, when I'm going to be doing the blood work review, I will have to do that disclaimer again. But tomorrow, we're going to delve a little deeper into insulin, how it works, the curve of your blood sugar, and what are the other hormones that work with it, why you get started on certain medicines, why you're given certain supplements, and what are the things that will impact that curve, the blood sugar curve. We're going to delve a little deeper into that. Wednesday, we're going to review blood work. A lot of you have submitted your blood work. I think we have totally, so far, I think 7 maybe blood work. I potentially could have read 9, but we have, I think, 7. And what I'm going to be doing is I'm going to take all of the blood work. I think one of you has a very extensive lab work done, but I'm going to do the blood work without the names of the patients, but it'll be in a slide format. And it'll give you an idea of what kind of blood work and why we need to do such extensive blood work. Then on Thursday is our cooking. Now, I know we send you a couple of recipes. We got feedback like we want to do what is in our pantry, what's in our fridge. I don't want anything exotic. I don't want to have to go and buy anything for this particular thing. That's fine. If you want to drop into us an email, what you would like to have done, like is it dressing, is it sauces, is it a dish? We chose a breakfast dish. So that's easier, something that's a healthier version with lots of fiber and protein for a diabetic. That's what we chose. But if there's something else that you want, make sure you send us an email tonight. It's difficult for us to prepare for this because we have to prepare for it too. So make sure you let us know if there's some specific dish. We're going to be able to do only a couple, maybe 2 or 3 on that day because I want to delve a little deeper into the nutrition for a diabetic. And then on the 5th day, I'm going to bring all of this together and put it in a very systematic format so you know exactly what to do. Everybody goes on the internet and, the World Wide Web gets information, but how do you string it together so it makes sense? And that's one thing that I can help you with. So we'll get started. Today is to see what puts you at risk for metabolic syndrome or insulin resistance. So I did it in a flip chart because as I was preparing for it, I probably should show you guys. I showed my staff what I've been doing. I'm going to lift the camera. This is like all of the articles I've read in preparation for this challenge. There's a lot of information out there that have been proven, and my job is to make sense of it, what is practically applicable, okay? So what you see here is what puts you at a risk for diabetes or metabolic syndrome, and we'll get into what metabolic syndrome is. You guys see the red, orange, and green? Can you distinguish the colors on the on your screen? If so, say yes. Yes, perfect. So type 2 diabetes, the things in red are the things you cannot change. What family you got born into, you cannot change. You can't change your race. You can change your age. As you continue to age, you can reverse it, right? So those 3 are stationary. The things in green are all the things that you can change, but they also contribute to type 2 diabetes. Watching TV, we'll get into that a little deeper. Obesity, 90% of diabetics, type 2 diabetics, have obesity. Not every obese person becomes a diabetic, but they may have other symptoms of metabolic syndrome. Decreased physical activity. It's a little different from TV, but I think they go together, but the studies were done such that it shows just your physical activity. You don't even have to be somebody who's watching TV, just decreased physical activity. Sugar drinks specifically, and we'll delve a little deeper into that, alcohol and tobacco, and of course the standard American diet. So you can see a lot more that you can change. Then the ones in orange is the socioeconomic status. That can change, that can be shifted with time. Medications can shift with time. And then the postmenopausal, and I see that on the screen, it's not actually clear, but you can see that when a woman becomes postmenopause, from 30% increased risk for diabetes or metabolic syndrome, it goes up to 60%. So almost doubles when you get postmenopause. Is everybody clear with this? This is like really what I'm going to delve into today. So let's start with a few things. What are the stages? How do you know if you are developing metabolic syndrome? This is very key. So most folks feel like, I was perfectly fine, and then I went for my annual physical exam. Last year, everything looked good, but this year, my doctor tells me I am a pre-diabetic. Does it really happen overnight? That's a question you have to ask yourself. A lot of times, there's something called an insult. So the insult is usually an infection. So let's say 2018, till 2018, every annual physical exam was perfectly fine. End of 2018, you had the flu, just basically the flu. You always get vaccinated, but this particular year you got the flu instead of the vaccine. You were sick for about a week, and then everything got back to normal, but something shifted in you. And 2019, when you went for an annual physical exam, your blood sugar was a little high, or you felt like there's a fatigue that doesn't go away. I'm just not back to my normal self. So that infection would have been what we called a trigger. Now, a trigger is something, so normally when you have an infection, you fall sick, you're sick for 3 or 4 days, and then you get completely better, right? However, when you have an infection that makes you sick, but you're not, like you get really bad, 100% worse, you don't get back to 100% better. You're at probably 60, 70%. What is making you stay that way? That's called a mediator. Mediator means something that is allowing you to stay sick longer. And that usually is a few things. Number one is your environment. What you're eating, what you're exposed to, what you put on your body, or who you hang out with. If you have a very stressful job or you have a very stressful relationship, all of that factors into continuing that insult and keeping that flame lighted. So something triggered the flame or lit. That would be your infection, but you continue to be sick. You're not back to 100% well. I see this all the time. People will go traveling, will have traveler's diarrhea, come back, and they're never the same again. And it takes months to gather, sometimes years, and sometimes they never get better unless they seek a different kind of care. So, and all of their blood tests will be normal, except for these kind of mild abnormalities. Sometimes it could be an emotional loss. You may lose a spouse, or you may lose a child, or you may lose, a pet. Something that was a very strong emotional stressor will be a huge trigger, and you never get back to normal. There's always that feeling of gloom and doom. That again is called a mediator. Now, once again, I'm going to pull this up. I realize I need a wide space camera, so I look at it this way. The triggers come in, and the mediator. Something keeps you moving towards disease. What are the other things that happen? Physiologic. Women, very common. After their very first pregnancy, they never get their health back. They have never been able to lose the last 10 pounds, or they have never been able to like sleep well after that. Their periods are never normal after that, or they just feel a certain degree of fatigue and they chalk it up to having a baby that's crying at night. That's a physiological stressor. And sometimes just the first period, a child gets the first period and suddenly their mood shifts and their weight shifts. They have PCOS and all of those. Those are all triggers. And even boys, when they start, you can see the crack in the voice and their hormones surging. Something shifts and they begin to accumulate more fat. What shifts? That's what we have to see. That's called the trigger. Now, a lot of times the trigger comes and it gets better and you get back your health. At other times, it just slowly continues to develop and becomes a disease. And this part is very important. Most of the time, people don't seek help for weight gain, right? They try diets on their own. They try to exercise. They want to fit into their, I'm so sorry, because I have to do this. I had to keep my phone on since I'm going live on Facebook too. So they have like weight gain, they don't go to the doctor. They have hair loss. A lot of people don't go to their dermatologist unless, they'd rather surface the internet and try to figure out what are the things that they can do as far as the hair loss goes. Sometimes seasonal allergies, they don't address that either. Then you have like the pain, like knee pain, joint pain, or migraine headaches. Even that you don't go to your doctor on a regular basis. You somehow manage to take some Tylenol or something for your nausea. Sometimes it would be sleep issues. Slowly you'll find you're sleeping shorter hours at night, or you're not having a full, complete, you don't feel rested. But life is so busy, you just continue to live your life that way. And then bowel issues. Your bowels are not regular, or you get diagnosed with irritable bowel. So these are all things that most people tend to live with for several years. Is everybody following me? All right. Looks like some people have trouble with their video. Let me know if there is trouble, because I think my internet connection is really excellent here. As far as the audio issues too, everybody can hear me, right? If I have to wear headphones, let me know. Okay, awesome, thank you. So once again, to look at, this is called the pre-symptomatic phase. This is the acute phase where you have the first insult, whatever the insult may be. Pregnancy could be your first time you had your periods, or it could be the first time you had an accident. Whatever it may be, that is the insult. Then there is something that is in between where you get diagnosed with just one disease, either Hashimoto's, or you had gestational diabetes, that means diabetes during pregnancy, or you just have, men particularly have only cholesterol. They go to their doctor, the cholesterol is high, get put on a cholesterol medicine, or just high blood pressure. And it runs in the family. Everybody young in their family, all the male members tend to have high blood pressure. Or it could be just the first time you've ever been diagnosed with the disease and it's a cancer. Women who have cancer in their 30s. Or it could be just pre-diabetes, where your blood sugars are running high, but your doctor says, just exercise, eat healthy, and you'll be fine. Now this part, the middle part, the pre-symptomatic phase is very acute. It goes away. It looks like it's almost normal, but you're not there. But this pre-disease state lasts several years. This is one of the reasons why the medical system makes so much money. Because at this point, you are comfortable, you don't address any issues. And when you don't address any of the issues, it has enough time to destroy the whole system, the physiology. This is where, that's called the tip of the iceberg, right? When you're looking at just, oh, I'm just having difficulty losing weight, or I'm just having seasonal allergies, that's the tip of the iceberg. It's not a very simple problem. Seasonal allergies for me is probably, or food allergies, food sensitivities is a huge, huge flag that something is not right, or you are going to lose your metabolic pathways. So take all of these symptoms really very seriously, very early, because it's easy to rebuild health at this phase than at this phase. Most of my patients come to us in this phase. What is this phase? This is the disease phase. You have multiple diseases now. You got high blood pressure, cholesterol, heart disease, or diabetes, or you have depression and fibroid uterus, fibrocystic breast disease, or you have migraine, headaches, weight gain, and thyroid issues. So multiple things are going on. And at this point, everybody wants to get healthy. How fast? Like this. And so when you look at the multiple diseases, when people come to us with multiple diseases and you're trying to rebuild your health, that's where the problem comes, right? It is like so many years of destruction has gone on, or the body has tried to do its own repair, and renew and repair is what we think it does, a lot of defense and repair. By the time you come to a physician trying to rebuild your health, you have a lot to actually unpack. So when you come to this disease state, for every decade that you've been sick or you didn't know you were sick, like you've had these issues, you need 1 year of recovery. Is everybody following that? For every decade, so for every 10 years you've carried a disease process, it takes 1 year for you to recover. So when you come in, people do sometimes testing with us, sometimes 90-day programs, sometimes they do 6 months programs with us, and there are other people who do 1 year. Unless you're very progressive, consistent, and every day invest into your health, for you to get your health back, it takes anywhere from 1 year to 18 months. Is everybody with me? Awesome. Thank you, Darcy. Yes. So let's look at diabetes or insulin resistance, and this is a female. In a female, how does it present itself? It comes up as hypoglycemia. Young girls have this very often. Boys, for some reason, don't have it. They tend to have drop in blood sugar. They get very shaky. So what their doctor tells them to do is carry candy, carry cookies, and they truly believe that that's what they have to do. I used to be taught that, right? Somebody has hypoglycemia, give them candy, let them carry candy in their bag. But actually what we're doing is we're making their insulin resistance worse. And a lot of times we're not taught this. So sorry. Okay, people can watch me on Facebook, I hope. So what happens is when you have that hypoglycemia, we're going to see tomorrow when I show you the insulin curve where that hypoglycemia comes. That means that person actually needs to back off sugar and get their insulin, the surge of insulin better. And we'll talk about it tomorrow. Gestational diabetes is when you're pregnant, if you have diabetes, or even you have an abnormal glucose tolerance test or GTT, you're at a high risk for heart disease as an older person. So women, particularly who have gestational diabetes, will tend to have cardiovascular disease in their 50s and 60s, or at least hypertension, puts you at a high risk. So that's why all this is important, because people will say, I have women who come to me and say, only during diabetes, only during pregnancy, I had a little blood sugar issue. I got started on insulin. I'm fine now. But that is a huge marker. You have almost 40 to 60% increased risk of having heart disease in your mid 50s and 60s if you don't change anything. And most people are not taught to change anything. Neither are the doctors taught to change anything. We're just told, hey, there's a higher risk. But what do you do between this and by the time the same woman becomes middle age? That is not a part of our traditional medical training, which is why a lot of us don't know it, even when you go to your doctors. Endometriosis, another very painful condition. Endometriosis usually has a lot of hormonal abnormalities, but it's very much a part of insulin resistance, just like PCOS or polycystic ovarian syndrome. A lot of young girls get cystic acne or acne, hair loss. All of that comes with both autoimmune condition as well as insulin resistance. Painful menstruation. That's again very classic. If you see, they did a study in the villages of India, where they found the girls who were in the villages never complained of menstrual pain, and they did produce an ovum. The saying is that when you have a lot of pain, you're producing an egg, and you have painless periods, you're not producing an egg. But in the villages of India, they found the girls did not have any problems with their menstruation. But what they did is, because of the cultural belief or religious belief, when a girl has a menstrual cycle, they actually have her sit out of the house. They have a separate place where she's allowed to sit. She's not working during that time. She's not doing any household work. She just sits there, reads, and she's given very bland food, mostly fruits, mostly raw foods, mostly what is in season. No spicy foods. And they find that a lot of our food can impact the pain during menstrual cycle. In fact, we've had patients who've joined our practice and their pain during menstruation goes away as they shift their diet. Heavy bleeding. This is a little different in younger girls. It's usually because of the high estrogen, so they have a lot of bleeding. But in older women, it's usually due to fibroids, because in the earlier parts, their insulin resistance was never reversed. As of today, this is something everybody should remember. In medicine, remember I showed you the 3 stages? We can reverse. When people come and say, can I reverse a disease process? We can reverse it completely 100% in these 2 stages. When you come to this stage, we can get you 80% better. It's unless you are very, very vigilant, like you never fall off track. But at these 2 stages, we can completely reverse. People are calling us when they have cancer. And I never take a cancer patient unless they're willing to do cancer treatment, because this is in addition to doing their traditional treatments, because even today, the treatment of cancer has not changed, but medical legally, it does improve their success rate if they get the treatment, the traditional treatment. So when you have disease, you do need to do the traditional treatment, but you got to rebuild all of the health parts too, the root causes of health. So let's look at other things. Overweight. They just begin to gain weight and have no explanation. They haven't changed their diet, they haven't changed their exercise habits, but they begin to gain weight. That's it. Usually it's leptin resistance, which again I delve into a little more deeper tomorrow. Infertility, very common, and a lot of times we force a woman to have a baby because that's so important. So usually infertility is the body's way of saying, I'm not ready to have a baby because I don't feel secure. And so this infertility has been written in the old medical textbooks. These women used to be very manly. They used to have hair, facial hair, and they would have broad hips. They would be heavier, but they would not bear any kids. And that part of it was when there was famine, a lot of stress, the body automatically shuts off that ability to have babies. So infertility, we got to dig deeper and find why a woman is not having the capacity to have a baby, rather than just try to stimulate. Right now, because science has advanced so much, we're all wanting end results. We want to look young, lay on a table, get up and look young, right? And we want our arthritis gone away in a minute, so we just get joint replacements. There's a beautiful Netflix documentary, watch it, called The Bleeding Edge. It's about joint replacements, how these joints actually create autoimmune conditions for most people, the titanium joints. So it's not as simple as that. So when we are, short term, I want everything fast, there's always long-term consequences to that. And then, of course, fatty liver, very common condition. There's actually a genetic trait to develop fatty liver. So that's why I'm a big fan of genetic testing, since it's available now. And then skin conditions, which is the black pigmentation around the neck, the elbows, and skin tags. So as you get older, you will develop a lot of skin tags. So once again, guys, make sure you're typing your Q&A in the Q&A box, so at the end of it, I can actually answer all of the questions. Now, in men, it's a little different, because they don't have as many freaking hormones as we do. It's high blood pressure, That might be the only symptom for almost 2 decades before they begin to have weight gain, cholesterol issues, erectile dysfunction, or cardiovascular disease. In fact, one of the main reasons we try to address metabolic syndrome and insulin resistance in this country, it's not because we think we can reverse it, because we want to avoid cardiovascular diseases, but sometimes cardiovascular disease is the very first sign that you have metabolic syndrome. So when you look at this, you can see it's usually one, low vitamin D. A lot of men come in with low vitamin D. They also come in with skin issues like eczema, pigmentation that tags, psoriasis, and increased fasting blood sugars. If you have high fasting blood sugars over 100, 10 to 15% of those patients will become diabetics. Is everybody following me so far? So you can see we can catch these things so much earlier, but at this point, no one is feeling bad. The biggest reason, one of the most common reasons why preventive medicine will never fly in this country is we tend to shift, we tend to change only when there is pain. If there is no pain, you go to your doctor and they give you a pill, and taking a pill is no biggie, and it becomes a routine. There is no push for you to change. And that's probably why that's an issue. So HDN is hypertension, by the way. I know I probably, when I say this is hypertension, increased abdominal obesity, increased cholesterol, decreased vitamin D, erectile, EDs for erectile dysfunction, skin issues. There are several skin tags, hyperpigmentation, eczema, and psoriasis, and increased FBS is fasting blood sugars. 10 to 15% of them become diabetic. So when you watch this video, again, it'll all fall into place because I am reading off of this. So don't get too confused by trying to see this and also listen to me. But this is really something that you find as a risk in men. Now, this is where, when do I know I have metabolic syndrome? Everything in blue is metabolic syndrome, but I'm going to go over this. Like I said, the main reason why we want to tackle metabolic syndrome and why we can reverse, in fact, CDC has acknowledged that metabolic syndrome and prediabetes can be completely reversed. They never talk about disease reversal, right? But this is one condition they have acknowledged that it is reversed. Most people just have fatigue for a long time, because as your blood sugars fluctuate, your energy production or energy supply to your cells is fluctuating. All of your hormones will fluctuate based on your energy intake. So when you're eating, always food should be because we're trying to get nourishment. But a lot of times food for us is because we're bored, or because we're entertained by it, or because it's just there. Right? How many of us do the seafood diet, right? I see food, so I eat it. So fatigue is something that's very common, and it develops over a period of time. And how do you know you have fatigue? In the past, you would be coming back from work and you can actually get your household work done and a lot of other stuff. But as you've gotten older, when you come back home, you just basically want to have a shower and go to bed. That's the kind of fatigue that you can have. Insomnia, very disrupted sleep, that can be another huge problem. And when you have a disrupted sleep, the question is, how disrupted? Are you not able to sleep? Are you waking up several times in the night? Or are you not sleeping at all, just barely getting 1 or 2 hours sleep? That can be a huge, significant problem before you develop a disease process. Thyroid fluctuation, very common again. Dry skin, hair falling, having this, particularly 30, when people tell me I gained 25 pounds in the last year and I did nothing new, that's their thyroid not working. Cholesterol, particularly the triglycerides, go up. This is very common in the South Asian population, and HDL completely tanks. It really goes down. We call it dyslipidemia. So that blue one, the increased triglycerides, low HDL, are one of the 2 common characteristics of metabolic syndrome. Hypertension, very early high blood pressure. Right in their early 30s, they begin to develop high blood pressure. Pre-diabetes is increased fasting blood sugars, like I mentioned. Anything over 100 currently is considered pre-diabetes. For me, the way I would look at it is the first year, if a patient comes to me for an annual physical exam and their blood sugars are, fasting blood sugars 80, the next year it's 85, and the third year it's 90, I know they're headed in the wrong direction. By the time they come to 95, 96 as fasting, I consider them already pre-diabetic. So that's when I intervene. Again, the reference ranges are very different. I still stick to the reference ranges I had in 1984 when I first went into medical school. And the reason being, as a population, we've become unhealthy. The environment has become unhealthy. In fact, I've said this before, walk into an airport or walk into a public space, almost 80% of the folks there are overweight or obese. That's how much inflammation is there, but they're not necessarily diagnosed with the disease. So their lab is considered normal. So our normal reference range has become very wide. So I would say if your fasting blood sugars are consistently over 95 or even over 90, I would worry about that. Weight, particularly abdominal obesity, and we'll talk about the different types of obesity in a minute. Breast cancer, very common, especially in women. In fact, the number one reason for breast cancer, 90% of the breast cancer is due to high-fat diet. And 21% of breast cancers are due to alcohol. All the things that cause diabetes, all the things that cause high blood pressure, all the things that cause cardiovascular disease cause your cancer too. And irritable bowel, and the last, irritable bowel is sometimes one of the very mild symptoms. Irritable bowel is where sometimes you feel like you got to go very often, and other times you're just constipated. And when they do all of the testing, nothing is wrong. Like there is no gastritis, they can't give you a diagnosis, they call it irritable bowel. But irritable bowel, we know today, is the first step before you get colitis, like an autoimmune condition where the body is destroying its own gut. And also, eventually, it can put you at a high risk for colon cancer. So all of these, you can see how all these diseases are intertwined. It's not just about metabolic syndrome. So things you cannot change is age. Your risk for metabolic syndrome goes steadily high up to the age of 70. After about 80, in some of the studies when they did the analysis, after 80, there's a chance that you're getting low. And I think to some degree it's because you eat lesser, your stomach has shrunk, and your fat stores are less. So your metabolic syndrome goes all the way up to the age of 70. But remember, when they did the studies, they're not looking at intervention. They're not looking at people who exercise, who took care of themselves. They're just looking at the general population. 90%, or in fact, I would say 98% of us live very mediocre lives. We don't try to excel in anything, whether it be financially or in our emotionally or spiritually or health-wise. So generally, the average human being, if they don't do anything, they do have an increased risk for metabolic syndromes, that's abdominal gain or girth increase, or increase in triglycerides, decrease in HDL, increase in blood pressure. All of this and increase in fasting blood sugars happens. Between the age of 30 to 39, there's a 15% risk. Between 40 to 49, there's a 23% risk. You can see by the time you're in your 50s and 60s, you have a greater than 25, almost 30% risk of becoming, having metabolic syndrome. And at 70 to 79, it comes down a little. Okay, so as much as we think ages, remember this is people, they just study the general population that did not do any exercise or any dietary modifications. So when you look at why age, number one, we tend to eat quite a lot as we get older, and we tend to be less active as we get older. But can we change that? That's one of the things you can absolutely change. Activity, can you change that? very much. In fact, I think an example will be my in-laws. When I first met them, which was like 25 years ago, they both were much heavier than they are now. And I have never seen anybody exercise and take care of their nutrition like the two of them. They are very meticulous. My mother-in-law will never go and take a second helping from once she puts it on a plate, she eats that and she never goes for a second. When she does, which I've seen us do twice in all the years I've known her, it is like it has to be something that is absolutely exotic and she just wants to have another one. So that I find has really shifted their health. So I find that when you decrease your caloric intake, increase your activity, your health will shift even in the latter decades. And both of them are in their 80s at this point, and they are really, I think they're healthier than I am. They don't have half the stress I do. Then comes the hormones. Hormones also impact because as you get older, a lot of your sex hormones change. Your testosterone goes down, your estrogen is almost zero for most women, and estrogen is a huge support for women, protecting them from diseases till they become menopausal. And then there's also some decline in the beta cells. Beta cells are those cells that produce the insulin, which is sitting inside your pancreas, which is also a digestive organ. So almost 1% a year you lose of the beta cells. So like by age 50, you should have lost 50% if you don't take care of your health. And then again, you can see pre-diabetes, you've almost lost 50% of your beta cells. And by the time you're a diabetic, you've lost 80% of the beta cells, which is why they tell you sometimes in traditional medicine, you can reverse these things. But what I have noticed is to some degree, you can revive them. We have seen people over and over again revive their lost cells because of transformation in their lifestyle. So I want you to keep that in mind. And then again, estrogens, they keep our HDL high. That's why women have a higher HDL requirement. They need to be above 55. Men, all they need to be is above 40. And LDL is also low in women, but the minute they become menopausal, their LDL goes up. LDL is the lousy cholesterol or low density lipoprotein. Now, the other two things that you cannot change is the sex and the race. Now, in men, non-Hispanic whites tend to have a little higher incidence than many of the others. Like when you compare to women, Hispanic actually have the highest incidence of diabetes after the American Indian, and you have the South Asian. But non-Hispanic whites, then you have the Hispanic, though I think they are a close race. If you're truly very much like don't exercise, don't eat healthy, Hispanics do 1/3, 1 out of 3 will have metabolic syndrome. African American, American Indian, and South Asian. American Indian and South Asian, almost 50% of the men have metabolic syndrome. And I think it's really much higher. If I were to go into a gathering of Indian men, I would say easily about 60 to 70% of them have metabolic syndrome. And this is something that is being seen with race as well as with the sex. Now, post-menopause, estrogens really help in keeping your cholesterol and triglycerides down. So if you become menopausal in your early 40s or early 30s, the premature ovarian failure, which can usually be an autoimmune condition, I would highly recommend bioidentical hormone replacement therapy. So that's called BHRT. So it's bioidentical hormone replacement therapy, means it is in the same, we're trying to maintain the same levels of hormone like you would have biologically speaking, even though we supplement it. And usually they come from natural plant sources, not from animal sources. Most of the studies on hormone replacement was done from the horse urine, pregnant horse urine. None of whatever studies you see in hormone replacement therapy, which causes cancers, are done from that. A lot of the bioidentical hormone replacement therapy comes from plant sources. Not that it's without risk. It does have its own risk too, but it's important to know that the estrogens protect us. So when you become menopausal, in fact, when you start having irregular periods, that's the time to step up your exercise, look at your nutrition. You will not have the hot flashes. People who have a lot of menopausal symptoms tend to be a little bit metabolically challenged. That means they have underlying metabolic syndrome, so they have the hot flashes and they have the night and cold sweats and the night sweats where they're drenching and having to change their clothes. That's again very important. The other thing that happens when you're menopausal, you have an increase in abdominal girth. Suddenly your leptin resistance becomes an issue because your estrogen is out. And a lot of times this becomes, a lot of women will never gain weight, but they can't fit into their pants. And it'll be just in the abdominal girth. That's very important to understand. Is everybody getting that? So again, if you could put your Q&A into the Q&A section. I'm seeing a few in the chat. I'm just afraid that I will lose them if they are in the chat. So this is the two types of abdominal obesity. I'm not an artist, but this is the best I can do. So I want to show you. This is called subcutaneous fat. This is where when you can pinch your skin, there's more fat that you can hold. Women tend to have this. This is actually coming from estrogen, and a lot of times what really is important is this person is not going to lose their weight by just exercising. They actually have to do a detoxification of their estrogens. That becomes very important. The SCF is subcutaneous fat, and they would have normal triglycerides. So their triglycerides won't be high like as in metabolic syndrome. They will have a decreased LDL and normal HDL, but they'll have abdominal obesity, and it's really coming from estrogen. Is everybody seeing that picture here? Now in this one, let me see if I have one. The obesity is a little more here. You can pinch the skin. There's not much there. All of the fat is internal. That is called visceral fat. That means the viscera is your organs. All the fat is surrounding these organs. That fat is the white fat. It's called WAT, white fat. Brown fat helps with us losing weight. So when you go out in the cold, it's the brown fat that will create the heat, keep us warm. But you have more of white fat or something that is covering, surrounding your organs. That's where you're going to start having problems with your cholesterol, problems with your blood sugars. And that's where you have a lot of inflammation. And tomorrow we'll talk a little more about inflammation. People who have this decreased HDL, increased triglycerides, visceral fat are the ones who will benefit from lifestyle. These folks will need detoxification. You see the difference between the two? Everybody following me so far? Okay. Now, family history. This is another one that we can change, but how important is family history? So what they did is they try to sign people up to see if family history really impacts children. This is important for those of us who have metabolic syndrome and we want to look at our kids' futures because you can impact their health. They don't want to wait till they are 50 and try to rebuild their health. So they took 160 folks. Out of the 160 folks, 150 kids from these 160 folks enrolled in the study. And they checked their waistline, their blood pressure, their HDL levels, their triglycerides, their fasting blood glucose, FBGs, fasting blood glucose. They also checked their liver functions, their 90-day average of blood sugars called A1C, their insulin levels, and they looked at their lifestyle, looking at their exercise and their meals. And when they put everything together, kids who came from a family history of metabolic syndrome were actually at 50 to 60% increased risk for metabolic syndrome themselves. This is so important because they were much more obese, they had more triglycerides, their liver was fatty. So just having parents who have metabolic syndrome, their children had a 50 to 60% increased risk for metabolic syndrome. This is very significant because you can see that family history really denotes not genetics. They didn't look at genetics, they just looked at the lifestyle. So it really goes to show you it is our lifestyle. How we eat is how our kids eat. So when you shift, when they see you shifting how you eat, how much you exercise, they too shift and everything gets better. So it's very important to impact their health. So the things that you can modify, always, that's why so many weight loss programs are there. Your weight, particularly abdominal obesity. So I'm a big fan of fat measure rather than BMI or body mass index. Because body mass index, people who have a lot of muscle can actually look like bigger than they are for their height. What you want to go for is the weight. When you do the weight plus fat content, and you want to be less than 16% of body fat. Then the waist measurement, a lot of times the waist measurement in women is 88 centimeters, and in men it is 105. Here's why this is important. And when you look at a lot of the nutrition, the last part, the movement and nutrition, we'll get into that. In the nutrition, 13 to 15% increase in metabolic syndrome if you ate red meat, processed meats, soda, and refined grains. That's the standard American diet. Pretty much bread, bacon, and a couple of broccoli, right? And then 1 to 2 servings, if you had like pretty much the normal servings, if you take 1 to 2 servings, this is when they ate red meat with every meal. And they had soda and refined grain with every meal. 13 to 15% increase. 1 to 2 servings, like maybe once or twice a day that they eat meat, increase the risk actually by 1 to 2 servings with each meal. 1 to 2 servings is 17 to 26%. And lower if they were only 1/4 the servings. So instead of eating the full amount, they would have only 1/4 of the servings. Now there is something that increased the risk by 34%. It starts with the D and it ends with an A. It's got 2 words. This is like a quiz, right? Yeah, live recordings, right, Marina? So 2 words. It starts with a D and ends with an A. What do you think increased the risk by 34% of metabolic syndrome and type 2 diabetes? Who can write that down for me? Try to take a guess. Trying to make sure the stand doesn't fall again. We just have a few more slides. And most diabetics tend to do this. If they are not following, they're living under a rock and they don't read everything that's being told in the news, they tend to drink this. I'll give you an idea. Drink this, and this particular one you can answer in the chat. It starts with a D and ends with an A, but it's 2 words. So the D is 1 word and it ends with a Diet Cola. Diet soda. Exactly. Diet soda increases it by 34%, the risk for diabetes. This is why I'm not a big fan of diet anything, because you're cheating the body and the body tends to actually increase your insulin resistance. So that's very important. All right, let's look at the next one that we can actually change most likely, and that's medications. Antidepressants, very commonly, especially things like Zoloft, Prozac. There's something antipsychotics, they're called a newer antipsychotic, Zyprexa, Seroquel. Literally, I have seen this. I remember another part of my life is jail medicine. And many folks in the jail are young men and women, and they all have addiction problems. That's how they get into a life of crime. And one of the things what happens when they come into the jail is they've been told as children growing up that they have bipolar, they have schizoaffective disorder, they have personality disorder. Many of them start self-medicate with methamphetamines or just meth and cocaine. and heroin and all of those things. They snort these things, but when they come into the jail, they want me to start them on an antidepressant. So I will start somebody on, say, in February. By March, they would have gained 35 pounds. It's a tremendous impact on your metabolism as antidepressants. In fact, when people get off antidepressants, they get crazy, but they will be thin. So it's something that we notice with a lot of our patients. Statins, 25 to 30% risk for increased risk for diabetes, particularly over the dose of 40 milligrams of simvastatin was studied. It's more prevalent in women than in men. But it's very important if somebody's been taking a cholesterol-lowering medicine for a long period of time. In fact, a few years ago, a lot of the cardiologists used to take cholesterol-lowering medicines because they believed so much in the statins. But this one thing, when they started having increased blood sugars, they stopped the statin. So statin can actually drive up your risk for diabetes. And then the HIV or antivirals, we're talking about COVID, and we wanted to give some HIV medicine, but these HIV medicines actually increase your weight and increase your risk for metabolic syndrome. So antivirals are not so easy to just take without any risk. Is everybody following me so far? So we're covering each of those risk factors so you can determine what you can change and what you can really impact. What are the things you can change? Then you have these entertaining medications, right? Alcohol. So you'll see that the news says one drink a day is actually good for your heart. Now, they did a study where they took women who drank on a regular basis, people who didn't drink, people who drank very occasionally. The surprising part is women who drank very little, like 1.5 to 2 ounces, did better in health-wise than women who drank like the whole one glass of wine, 4 to 8 ounces a day or half a bottle, whatever it is that they enjoy drinking, than women who just had a very small shot. And in fact, women who didn't drink alcohol at all did not do as good as women who had little alcohol. So it's not like alcohol is all bad, but the problem is how many of us who love, people who drink because they love it. Very few people can just drink 2 ounces, just like a shot of medicine, and be done with it, right? They'd like to savor a glass and sometimes another half. Tobacco, 100%. This is the one thing that hands down increases your risk for metabolic syndrome, high incidence of CADs, coronary artery disease. And the recommended thing in men is 2 to 4 ounces for alcohol, and in women is 1.5 ounces. That's very little alcohol, but this is what is really recommended. And to me, if you're not a drinker, please don't drink. I think there are different ways to reduce your risk for metabolic syndrome. The other thing is important to understand is if you're a daily drinker, your risk for breast cancer increases by 21%. That's quite a significant increase in risk for breast cancer, right? So I think that's something, and I think a lot of it has got to do with your detox pathways in the liver. Then we come to our programming unit, which is our television. What they found is people who watch, and right now our television is not TV, it's computer, right? How many of us sit in the computer? I can get into that and never get up from my computer. Less than 14 hours fared better than people greater than 20 hours a week. This is a week, not day, a week. So what they found is people watch TV from 6 to 9 p.m., like nonstop, and that puts them at a higher risk for metabolic syndrome. This study was done both in Louisiana as well as in Taiwan. And so we have an Asian and the American version of it. So you're at 2 times increased risk for metabolic syndrome. For every hour that you sit down and watch TV, I don't know if it's the stress of watching TV or something goes on in our body. They didn't do a test. It was just more a questionnaire. You are increasing in men 21%, in women 26% risk for metabolic syndrome. Just something like this. really increases your risk for metabolic syndrome. So I'm going to try and just summarize so that we can get back to these are the things that can change. These are the things that are modifiable, and these are the foundation things that are fixed. What do you think? How much can we impact our reversal, metabolic syndrome? Can we impact it? Yes or no? Yes, doctors should know, Ram, about the link between statins and metabolic syndrome. It is actually controversial. That's why a lot of times they don't talk about it. But there's a big researcher who does a lot of the work on metabolic syndrome. I forget his name. It'll come to me. He mentions it in passing, and nobody wants, because the impact of statins is so important for the high cholesterol induced coronary artery disease. Like it's one of the drugs that is supposed to be life changing, that they will not, for the risk for metabolic syndrome, they're not going to stop somebody from taking a statin. But let's get back to things that can change. Movement, we can change. I cannot emphasize how important exercise is, but if you're fatigued, you cannot exercise, or if you have pain, you cannot exercise. So it's important to address those underlying inflammation. We'll talk tomorrow about inflammation too. Watching TV or sitting in front of the computer, if you're sitting nonstop, my recommendation would be every hour on the hour, get up and move. 5 minutes, the movement should be for 5 minutes. Eating, of course, standard American diet, you can change. Sugar drinks, none of us need sugar drinks or juices. The only time I'm okay with juice is when you juice it fresh at home, and because a lot of the nutrients are there, and you mix it with vegetables. That is okay. The weight, can you impact your weight? Can you impact the amount of fat you have? Absolutely. Sometimes it's hormonal, you need detoxification. A lot of times we do the lifestyle first, and then I realize that they need hormonal detoxification because their body shape changes, and then management of stress. The modifiable ones, postmenopausal women can always have a hormone replacement therapy. Socioeconomic status can always be changed. It's a matter of trying to educate yourself or move up in life rather than sitting back watching TV and saying nothing can be done about my life. And then medications, discussing with your doctor and saying, hey, what do I need to get off my medicines? What are the things I need to do? Sometimes the traditional doctors would not know. They'll say you have to be on it for a lifetime. A question I ask my patients is, were you born with a high blood pressure medicine? And a lot of times the answer is no. But then remember, I actually work, again, like in the jail medicine. I said, somebody was asking me for an antidepressant. I said, you were not born with this. She said, I was. My mother was on it when she was pregnant with me. So sometimes it can happen that we are on medications. But a lot of times medicines are something we add in order to control disease. But if the disease is reversible, a lot of the diseases we develop, diseases we develop from lifestyle, and then management of stress is modifiable. The things that we cannot change is race, age, and family history. But the family history also, I think, comes back to things that can be changed in terms of lifestyle. So as we are kind of wrap up on my information part, a habit to change is very important. Pick up the habit that you have to change. Do not sacrifice long-term happiness for short-term pleasures. This is what we do on a regular basis. Oh, I don't want to exercise today. I just want to watch TV. Or I just want to have a little cake. I'm on vacation. This is what is going to create enjoyment. So it's a short-term pleasure, but you're really literally losing your long-term health. So remember, how you do one thing is how you do everything. This is something I've learned. And when you cheat on one thing, everything else falls apart. I'm sorry, guys. I know next time I probably should just make slides. As I was preparing for this, I found that I was writing on this, and I said, why not just show this to everybody? Because I really liked it this way. All right. Now, as I wrap up, a few things. There's one religion that has these health issues in their guidelines for their congregation. Anybody know which religion that is? Which group of people, religious people? Buddhism, Hindus, Jewish, okay, Jains, not even close, right? I'm going to flip it over. It is actually the Seventh-day Adventist. So Seventh-day Adventists are mostly vegetarian. They are lacto-vegetarian or pasco-vegetarian. That means some of them drink milk or milk products, and some of them have fish. They eat nuts every few days of the week. They exercise on a regular basis. That, like, as a congregation, they just do this. And then they have a faith and a community support. And what they found is that metabolic syndrome with the vegetarian group, even in this Seventh-day Adventist, they did metabolic syndrome in vegetarians was only 25%, whereas meat eaters, there are some non-vegetarians in the Seventh-day Adventist, and they had 39%, almost 40% increased risk for metabolic syndrome. So the key thing I really believe is this faith in community, because you will find, I mean, I've seen this in my own experience as seeing patients. I've seen now patients for 22 years, 23 years, or maybe 25 years. 25 years, almost like 96. Somebody can do the calculation. I started seeing patients in 96, right? As a physician or an independent practitioner. And one of the things I've noticed is some people just eat like crap. They don't exercise, they smoke, they drink. They're happy-go-lucky. Every time they come, they're so much fun to work with as a patient. Nothing ever goes wrong. And in fact, I remember one patient said, "Doc, you're going to die before I do," because I would advise him so much about losing weight and stopping smoking and not to drink and all of that, because he was such a jolly guy. None of his blood tests, of course, at that time I was a traditional medical doctor. I didn't dig deep to find the root cause. But a lot of times it is your attitude. It is literally your attitude that prevents diseases. So there's another group of people. It's called the blue zones. Has everybody heard about the blue zones? Yes, no, yes. The blue zones are group of people. There are 7 places across the world who live well past 100, but they live well. They actually drive, they cook. In fact, the guy who wrote the Blue Zones book, it's a very good book to read. When he was going to these villages and places in the U.S., it's a place called Loma Linda in California. So as he was driving, he had there was this lady carrying a basket filled with, I don't know, some plants that she had plucked, and he stopped and he said, "Listen, I'm going to so-and-so's house." And she said, "Why?" She said, "That's because, I need to interview her for a book that I'm writing. And I hear she is like old, but she's actually very, healthy." And this lady said, "That's me." So she was almost 99 years old. That's how healthy these folks are. But this is what they ate on a regular basis: whole grains, nuts, 1 cup beans on a daily basis. Fruits and vegetables was the majority. But I will also say a lot of, this fight between vegans and paleo and keto is never going to stop. But I will say, I read the book, majority of them did eat meat, but they ate it only once a week. They would kill their own cows. They raised their cows or pigs or whatever, and they would kill them, and they would actually take that meat and eat it. So it was fresh. And they actually did the act of killing, which is, if you're taking the skin out and taking the meat out, it's a lot of work. They sweat by the time they did. It's a half a day job trying to get the meat out of the, animal that you've just killed. And then there would be like 25 people at the dinner table. And a lot of thing is the older people, the elderly in the family, they were the center of the family. They're not like most of our elderly where they're in assisted livings and nursing homes. They were the center of the family. They had purpose in life. They actually did gardening. They actually participated in a lot of the cooking process. So this is not simply about nutrition. That's why when people say, what should I eat? It is, how do I live? What is the connection I have? So having purpose, having a community, having, it doesn't matter what faith it is, but if we have a community that is very positive, it's very unlikely for you to die of a disease. And I think a good majority of life in America is very lonely, especially as you get older. So the most important thing to resolve metabolic syndrome, get to your why. Why do you want to resolve metabolic syndrome? Who do you surround yourself with? Very important. Dr. Dean Ornish has written a great book. He was the first man who promoted veganism because he was a cardiologist and his only job was cardiac catheterization, putting stents. Till a patient came in, he was ready to catheterize this patient, and the patient went off and tried to find something, and when he came back, all of his blockages were gone. He didn't have to stent him. And so when he sat down and spoke to the patient, he said how he went back when completely gave up animal protein, went on this plant-based diet. So he started the Dean Ornish program. And the Dean Ornish program is the only program covered by Medicare. But to implement Dean Ornish program in a particular practice, it takes $25,000 because you have to have a yoga teacher, you have to have social worker, a nutrition coach, an exercise coach. There are 7 employees you need to have in order to bill Medicare and do the Dean Ornish program. But it's very structured, and pretty much what he came to the conclusion was the main thing that he found is how positive the patients were, who were they surrounded by. That's why yoga is a very big part of the Dean Ornish program, the meditation part of it. Food can be nourishment or entertainment or addiction. Nourishment is you're eating because you need the nourishment, the calories. Entertainment is, this is fun. I want to have it today. Today I'm going to have a small cup of ice cream. But it happens like once a month. Remember, we go for a concert or we go for a movie once a week or once a month. That's entertainment. You don't go every day. When you can stop eating and you know if it's that you just keep buying and you know it's not good for you and it's actually destroying you, that becomes an addiction. So mark off those foods that cause addiction, don't even buy it. And when you're going to the store, make sure you go after you grab a handful of nuts or a tablespoon of almond butter so you're full and you're not going to buy the foods that keep you addicted. Movement, activity should be structured. You got to sweat. You got to get your heart rate up. If you're not sweating, that is not good enough exercise for you. That will not mobilize your fat stores and increase your insulin sensitivity. Very important for that. So what you have to decide is, where do you need help? Are you having help with mindset? Do you need help with understanding the nourishment? Or do you need help with movement? Sometimes you need help with putting all of this together. And that's where you have to acknowledge, where do I actually need the help? So here's my agenda. Tomorrow we will talk about why we develop insulin resistance. And we're going to talk about the labs on Wednesday, meal prep on Thursday, and I'm going to pull it all together for you and give you the exact steps which you would need to do in order to begin to reverse your insulin resistance. So now I am ready for questions. I see only one question is the Q&A. So weight loss surgery is a quick fix with issues. I've had people tell me I should get it, but I feel like my health is a bigger issue. So Marina, did you want to answer this live, or are you just going to be allowing me? I don't know, maybe it's just typing it.
You can go ahead and answer it live, and then I can get out of there and I'll scroll up and look at the other questions for you.
Sure. Great. Thank you. So here's the thing about weight loss surgery. When you do weight loss surgery, you actually reduce your risk for diabetes. However, the gut is your second brain. The minute you do weight loss surgery, you lose a huge portion of your gut that absorbs vitamins and minerals. It's a constant maintenance. It's people struggle with anemia. A lot of weight loss surgeons ask you to eat a high protein diet. There is a specific doctor I like. He is very good. He really pushes a lot of high vegetable diet. There's also a physician here in Michigan who talks about a pound of vegetables is what he recommends his patients who undergo weight loss surgery. So before you ever consider weight loss surgery, get a good assessment. Number two, figure out if you have exhausted all other options. And all other options means changing your gut bacteria. That's really the most important thing. In fact, tomorrow when we discuss, we'll talk about the hormones and the impact of gut bacteria on insulin resistance. Because if you've addressed all of that, then it becomes easy to reverse insulin resistance. Weight loss surgery works for 50% of the people who do it. 50% are miserable. And in fact, yesterday I met a patient who told me, I just wish I had never done that. So it can go both ways. And I don't know if it is based on the surgeon or the pre-preparation before you have weight loss. It just makes you look phenomenal, but it's a constant maintenance. And a lot of people don't take their vitamin A, E, K, D. Those are fat-soluble vitamins. Those are the ones you'll become low in. And they tend to have brain function problems. And almost 80% of patients who have weight loss surgery gain their weight back. So that's the other important thing to know. And I don't know, I don't know enough. I haven't done enough of the studies to see what causes that weight gain back, but I think it's because they didn't shift completely their mindset. Okay? All right, what other questions do I have?
Yep. Another question is Gatorade okay after exercising?
Yes, if you sweat a lot, it's okay, but I'm not a big fan. I'd rather have you do a cup of water, a squeeze of lemon, a pinch of salt. All you need is sodium chloride and you are good. Or even there's an electrolyte called E-Lite. You can add that to water. The problem with Gatorade, it's got way too much sugar and way too much salt that we don't need, unless you're like a basketball player, like you're putting in hours of, like these guys do 6 hours of workout a day. They probably need that degree of electrolytes. But if you're doing a workout for 1 hour, no. Okay.
Next question is, we'll probably answer this throughout the week, but is there a particular diet that you recommend? Do you recommend gluten-free and grain-free? I was told eliminating these foods would reduce chance of diabetes and inflammation and autoimmune diseases.
Okay. So, like I said, a lot of times it's not the food that is the problem. It's your immune system that's the problem. Your gut, when it gets inflamed or stripped off, the mucous membrane gets stripped off. Well, I think when I do a gut, maybe when I do a gut webinar, we delve a little deeper into it. But if that gets stripped off, you're going to get sensitized to gluten, which is a protein, and grains, particularly. A lot of times it's very unsatisfying to have a meal without carbohydrates. You actually feel hungry within an hour and a half. It's the amount of carbohydrates, like I showed you with the blue zone areas. They ate a cup of the grains, a cup of beans. It's quite filling, and the rest of it was vegetables. So we talk a lot about it. In Holistic Icon, it is the fun, fat, fiber. Those are the 3 Fs. You want to have fun cooking and eating. You want to have a lot of fiber in your meals, and you want to have good amount of fat, the right kind of fat, not saturated fat. We don't promote butter and ghee and coconut oil and none of the oils, in fact. So in fact, when we come to the nutrition part, we'll talk about really removing oil. So for autoimmune, you really want to work on fixing your gut. That would be my answer. Then just, yeah, we eliminate a lot of these things when we're doing the detox, but it's not like a lifelong elimination.
If resting sugars are around 104, is insulin necessary?
So normally, no. When your sugars are, so here's what happens. When you give insulin, this is like giving a paycheck without doing work. right? You don't want to give insulin a little too early. But if you're not doing anything different, you're not changing your diet, you're not exercising, then at some point, you don't, remember your beta cells that produce insulin, they will die out if you consistently insult them. And at some point, non-insulin dependent diabetic or type 2 diabetics will become type 1 diabetic because they've lost all of their insulin stores. So it's very important to realize why you're getting insulin. So when we do blood tests, we do both your sugar as well as insulin. If your insulin is high, you don't need insulin. So that's how I come to the conclusion whether somebody needs insulin or not.
Okay. What's the recovery period if you are pre-diabetic?
So I've had people within a month they can recover, but if they are pretty much like a lot of times in the past, I used to do 6 months program in 90 days, like within about 6 weeks, they completely reverse their insulin resistance, right? And that's why we created the 90-day program. We decided we don't need people to hang out with us for 6 months. They can do it in 90 days. And so we shortened the whole program to 90 days. But that's what it takes. Sometimes people, men particularly, in 2 weeks, they're out. Their sugars are under control. There's no insulin resistance. Their resistance cells, when I do the blood test, I'll show you that. We look at a specific blood test that's all cleared out. And so it all depends on how dedicated you are.
I think this is the last question. When is going on metformin recommended?
Yeah, so metformin, there's a lot of studies that is coming out about metformin in people with insulin resistance. I'm going to delve a little deeper into that tomorrow. But metformin today is considered an anti-aging medicine. So if you have to lose weight and if you're willing to lose weight, getting on metformin early enough as you make the changes and then getting off of metformin is what I recommend. So I would do 6 months. Now, when patients come to me with the disease, remember the stage 3 where they have multiple diseases and they're on multiple medications, I try to get their sugars good enough such that I can get them only on metformin. Like everything else is gone, all other medicines are gone, and tomorrow we'll discuss all of the paths that we try to block to reduce your blood sugars. So I would say to lose weight, if you're going to really focus on it, get the metformin in, but with the hope that you will get off of it. Okay. I think that's all we had, right?
Yep, I think that's all I see.
Okay, awesome, guys. I hope this was helpful as an intro into the 5-day challenge. So now you know the risks and you can see that the modifiable factors are far more than what you cannot modify. So when you're in the pre-diabetes stage or early disease phase, you can always reverse it. That's why early detection is very important in medicine. That's what preventive medicine is all about, is early detection. It's not about preventing. If you can prevent it, if you have a history of metabolic syndrome, your kids need to start learning to exercise and eat healthy much earlier. So thank you again for joining us this evening. I will see you tomorrow evening at 6, correct?
Yes, yep. And it's the same link, so if you guys registered on your Zoom, you should be registered for tomorrow as well. Otherwise, it is on Facebook if you don't have the link to Zoom.
Awesome. All right. Take care. We'll see you guys tomorrow.
Yep. Bye.
Bye. Thank you.